Hi, I'm Dr. Ruben Bhasin Passi, consultant dermatologist, CK Birla Hospital, Gurgaon. Today we will be discussing something about cellulitis. Now, what is cellulitis? It's a very common bacterial infection which affects the deeper layer of the skin, majorly affecting the lower limbs, and if untreated has serious complications. Why does it happen? It happens when there is any injury to the skin, majorly a cut, insect bite, or a surgical wound. Now, this leads to entry of certain kind of bacteria, majorly Streptococci or Staphylococcus aureus. Majorly these bacteria, they enter and they cause inflammation and infection in the deeper layers of skin. Now, when we come to the signs of the disease, now there are two kinds of cellulitis that we generally see. One is an uncomplicated and second is a complicated form. In uncomplicated cases, we generally see a red, tight, glossy, that means a swollen skin, warm and tender to touch. Now, these patients have limited area of involvement, hence the history is not going to be that long and the area is going to be limited. Wherein, when I talk about uncomplicated cases, has more of systemic involvement, has red, hot, tender skin, might be a little violet, can have little fluid fill lesions, which we call blisters, and definitely the patient has unstable vitals and is a serious disease. Risk factors of the disease is immunodeficient state, chronic skin infections which are untreated, trauma to the skin, and diabetes mellitus. Now, coming to the treatment of the disease. In uncomplicated cases, as I told you, it is a limited area of involvement and less pain, no systemic symptoms. Hence, the treatment we rely on more of oral and topical antibiotics with some supportive treatment has a good result. Talking about treatment over complicated cases. Now, complicated cases have a lot of circumferential cellulitis. What does that mean? A lot of involvement of cellulitis from the primary lesion, a lot of systemic symptoms. So chills, fever, malaise, toxicity. There is a lot of, like I told you, violet skin color and a lot of blisters might be visible. The patient might be having unstable vitals. It requires hospital admission, series of blood and radiological investigations. At times, we would need a surgical intervention for the debridement of the deeper tissues. If the cellulitis has involved the deeper tissues, we don't want the infection to become decaying. How can we prevent the disease? So there is a type of cellulitis which is recurrent, as in the patient will keep on having the cellulitis. So a regular treatment of 10 to 12 months until the remission of the disease can help. Number two, and the most important, is treatment of chronic skin disorders, be it fungal, bacterial, or viral. Thirdly, diabetics. All the diabetic patients, they have to be very, very cautious of the infections they get, especially in their lower limbs. That might lead to cellulitis, and hopefully not recurrent cellulitis. If that happens, that needs to be treated as well. There are certain abscesses and wounds in the skin which generally patients avoid and don't get treated. So they have to be really taken care of and they have to be treated and get done with. And most importantly, lastly, I would say, no self-treatment, please, as chronic usage of antibiotics may lead to resistance in antibiotics. So that's going to be a problem. Thank you.